We are actively understanding everything that's going on at the bone cell level, even the molecular level, but also at the level of the whole human being and even the healthcare delivery system.
I personally have some recent experience with an orthopedic musculoskeletal injury and found myself, I think, in the same situation a lot of people do when they go to the doctor of what is the right choice for me, for my healthcare, for my specific situation, and not really knowing the answer. So I'm convinced that the work that we're doing in the lab is going to be practical and help guide those decisions for the physician or nurse or PA or for the patient so that they can make those decisions.
So all of the Musculoskeletal Center people are talking to each other, and each one is an expert on a different part of the musculoskeletal system. And so that allows us to look at the musculoskeletal system as a system rather than individual organs.
So I think the Musculoskeletal Center really allows us to bring the expert who's really top of the research in whether it's a molecular biology question that's something that's going on in a wet laboratory versus a question that may be more in a clinical context, and having access to those experts who can help you refine your questions and refine your research. I think that's a unique aspect of the Musculoskeletal Center.
The diversity of expertise, which provide all of these different lenses in which we can view and understand and study musculoskeletal diseases. And when that is combined with a lot of sort of support for trainees and training opportunities, it's really a very exciting environment.
We really focus on structural changes. And the historical view has been that the structure is what causes pain, but we're now understanding that that's not so simple and that there are patients that have pain that aren't appropriate for joint replacement, and we need to serve them. We need to have drugs to help them or modalities like exercise to help these patients feel better.
One of the aspects that we have really focused on is really trying to identify things like drug repositioning, so using existing medications that might actually have potential benefits for different types of musculoskeletal diseases.
Recovering from musculoskeletal injuries is increasingly going to be a multidisciplinary process that involves more than just what we do for patients in the operating room. It's going to be informed by our increasing knowledge of the importance of psychological and mental health recovery after trauma.
We're very hopeful that being able to use different strategies, either computational, AI, even developing things like bone models or tissue models that we can grow in the lab so that we can screen drugs quicker. Those types of strategies are going to be one of the key things that will allow us to identify novel therapies, but also use existing therapies more effectively for these types of patients.
A skeleton for cures.
A skeleton for cures.
A skeleton for cures at UCSF.